Thanks for joining us at Instride, Gaston, Foot and Ankle. Today I want to talk a little bit about ingrown toenails. So who hasn't had an ingrown toenail in their life? Some of the things that people talk about to do home remedies when you have an ingrown toenail includes things like soaking with apple cider vinegar or Epsom salts. I've heard my patients talk about cutting a V at the end of the nail, and all that does is just make a V on the end of the nail. So it doesn't really do anything because the nail grows from the base of the nail up. So that's some of the things that people will do. Things that cause ingrown toenails, tight shoe gears can cause it. If you tear the nail instead of cutting it straight across, that can cause it. Sometimes it's just a hereditary thing that your grandma or mom or dad had, and you're just predisposed to getting an ingrown toenail. So some of those things are the causes. Now, some of the treatments that we can perform, the first thing is that we can sometimes just trim the side of it and give you some relief, and that's an easy fix. But sometimes it's beyond that, and it gets to an infection point, or it gets so far deep into the base of the nail that we have to do a little surgical procedure. So I wanted to show you in a video kind of what we do so you are well aware of what you're getting yourself into. It is a pretty simple procedure, and after the toe is numb, you don't feel anything, and the relief that you get afterwards is phenomenal. So I'm going to show you in this video how I go about doing an ingrown toenail procedure. The procedure can be done either temporary or permanent, but if it has been an ongoing problem, if it has been chronic, then we usually do it permanent. That way it takes care of it once and for all. Initially, I just anesthetize the toe, or I numb up the toe, and once it's numb, then you don't feel anything. Once I do that, you can see here, well, I'll put a tourniquet around the toe. Basically, it's a rubber band that helps to keep the blood flow to a minimum, so that way I can work in the field without having to worry about blood, and it also allows the phenol, which is the acid that we use, to work more properly. So once that tourniquet is placed on there, then I have to release the nail that we're going to cut off, and then I trim a little section of nail, a little slither of nail on each side or on the side that needs to get done. I trim a little piece of it, take it all the way down to the root, and then you'll see here soon where I remove that part of the nail. Once that's removed, in order to make it a permanent procedure, what I do is we put phenol in that area. Phenol is an acid that kills the matrix or the nail cells. So once we do that and it's killed, those two little slithers of nail don't grow back anymore. So once they don't grow back anymore, then you're left with a pretty normal nail. As a matter of fact, it's hard to tell if the nail was removed or not. And then you have no more issues with it. And there's less than a 5% chance of recurrence, so it is a great procedure to do. I hope the video didn't make it too squeamish. You don't have to look at it, and when the procedure is done, we can lay you back so your eyes are looking up at the ceiling. And if you need our help with it, we would be more than happy to help you with it. We have same-day appointments available, and we're love to have you come see us. So thanks for listening, and I hope to see you all soon in my next video. Have a great day.